Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Thursday, September 3rd. I'm here again with Edward Brubaker, Living Branches President and CEO. I guess welcome to the unofficial last weekend of summer.
Oh, is it really? With Labor Day, I guess. Okay, yeah.
Here we are.
Welcome. Yeah, man. Wow.
Yeah.
September. Amazing.
It went quickly.
Yes, it did.
So.
It did.
Let me start, I guess, with a recap of where we are with COVID on our campuses. Very pleased to be able to say that we continue to have no COVID cases anywhere on our campus for anyone who is a resident or an employee. The caveat to that is that we do have an employee who does have COVID, but this person knew they had been exposed, so never were on campus at a time that they had the potential to transmit the disease. So we do not have to count that in our official counts. And maybe you just want to say just a brief mention about that situation, because prayers are needed.
Yeah, that's right. And I think we talked about this last week as well. And so, yeah, the situation is that there's a member of the family that is quite ill from this, and we do need to keep them in our thoughts and in our prayers, and really we hope for a positive outcome with this. But it just reminds us again, this disease is not gone, and it can be very serious. Not in everyone's situation, absolutely not. But in some situations, it can be very serious and very scary, and so certainly prayers would be desired in that situation.
Yeah. I feel like perhaps we've gotten a little complacent on campus. I had multiple calls this week from residents who were asking if we could talk about mask etiquette. Because they would reflect that they've seen people wearing masks improperly, other residents wearing masks improperly, not at all. And actually, I thought, that's probably a good conversation to have again, because some of the science has been changing around why you need the mask, how the disease is transmitted. So maybe we should touch on that again.
Yeah, and when we say science has been changing, it's our understanding of the disease has been changing. Science really hasn't changed, but as we learn more, as with anything in life, we find out more about how it's transmitted, and so we still need to wash our hands and keep our hands off our eyes and nose and all that kind of thing, mouth. Those are still very important. And I remember some of my very early videos, I'd say, keep your hands off the T-zone, etc. Still a very important thing from a transmission of disease standpoint. Having said that, I guess just to back up, we need to realize this was, I don't know about you, but last fall, I didn't even know, frankly, what a coronavirus was. And I probably would have made a joke about, beer or something like that if that was the case. But the fact is, we didn't, although I now know that coronaviruses have been around for a long time. It's nothing new. The strain is different. But just think about that. It hasn't even been a year yet. And so we're learning so much through this. And so we have to remember that, it seems to me, that does not mean we were, it could mean we were wrong, but it doesn't mean we weren't doing the right thing. It just means we're learning. Mm-hmm. And that's like anything in life. We're learning as we go. And so absolutely finding that the droplets and breathing and talking and all those kind of things, that's, as we understand today, how it's transmitted. And so that's why a mask is so important. And yeah, I've seen masks in public spaces, in stores, employees of local stores that I won't mention. They have a mask partially over their mouth, it's not over their nose, and you just kind of shake your head because you say, really? Like, you think that's going to protect anyone? But it's also, I don't mean to say that they're dumb people. We just need to keep educating ourselves and each other. It needs to go over your nose. It needs to go over your mouth. That's what is expelling things from your body. And so that's why it's so important to have both those areas covered. And it is not fun to wear a mask. I had one on all last evening. We were moving our daughter and her husband to a new apartment in Philadelphia last night, and my mask was drenched till the end of the night. My rest of my clothes were too. It was warm, but I did most of the time have a mask. Obviously, not when I'm eating and that kind of thing. But yeah, it can be a challenge to wear it properly. And I would also say we need to give each other grace and not assume that somebody's trying to be an anti-masker by not wearing it improperly. It's easy to forget. It's easy, as you said, to be complacent as well, to forget. I mean, I've had people in Rotary and otherwise that they're walking to the meeting and they're seeing, oh, I forgot my mask. And so they go back and get it. It's just normal human stuff. Let's be gracious with each other. But let's also keep reminding each other, too, it needs to cover your nose and your mouth to do any good. But it's really important because that has been shown. Now, maybe we'll learn more later, but as of what we know now, that's the primary transmission methodology. So let's do it right. The other thing is wash it. I've had this conversation with my wife, a mask sitting in your car for days on ends and just being worn when you need it, that's not really best protocol either. So, there's so many things like that we just need to be aware of and work at it.
I'd say one group of people that's really learning right now would be the scammers who are out there. We had a notification from one of our residents about some scams that are going around specifically about COVID, and it might be worth noting that for our viewers.
Yeah, that's right. And I would say, we say don't waste a good crisis. Well, scammers, I think they must have that in their mantra because with every challenge in society, it seems like there's a new scam that comes out. And it's unfortunate, I've commented already, like, these are not stupid people either, because they're figuring out the psychology of what people, wouldn't it be wonderful if these smart people who scam people could figure out ways to help society? I mean, wouldn't that be wonderful? I know that's utopian and I digress and I dream, but that would be nice. But yes, that's the reality. And, people that's the challenge too, because they're posing sometimes as contact tracers. And that's the unfortunate thing, because then it makes people distrust the potential real contact tracer. And so when you have a false person, false prophet, if you will, and a real person, how do you distinguish between the two? And that's for me one of the unfortunate things too, that it just makes people distrust the real stuff more when there's scammers out there. But yes, absolutely, scammers are out there, they're working the system, and it's no different than what we preach all the time with any of those phone calls. Basically, if you don't know the number, don't answer it. If it's that important, they'll let a message. If it's that important, they'll call you back. It's just amazing. I don't have my phone here right now, but I was going to hold it up, how this little device can just, activate parts of our brain that all of a sudden it becomes the most important thing in the world, that we get a text or a tweet or a phone call, and
yeah,
maybe it's fear of missing out. I don't know, but just relax. Don't answer the phone if you don't know who it is. But if you do answer it, don't get sucked in, because there are definitely scams out there. Absolutely.
Yeah. And if you have any questions about whether it's real or not, you can reach out to our team. I sit across from Bruce Alder, our Chief Risk Officer, and I hear the phone calls that he gets from residents asking, hey, is this real or not?
Yeah.
So we're here to help if
that's
people
right.
have questions about that.
Yeah, a relative of mine got one the other day, again, posing as a grandson. And, it's so easy to get sucked into those things, but it was no grandson. And when my wife got on the phone and started asking questions, there was a quick click on the other end. And so, but the best thing is don't even answer.
Yeah, if you don't know, don't
even
answer. Yeah. Let's talk a little bit more, if we may, if we can, about testing and rapid testing possibilities. I was at the Dock Woods campus earlier in the week, and I was talking to a couple of residents who were asking me about when water volleyball was coming back, and how nice it would be if we had a rapid test machine that we could use to determine before you go do anything, oh, are you positive or not? But some of the information that we're getting now from the government about our use of the testing machines makes that look highly unlikely in the near future.
Yeah, it's not going to happen right away, but I really do believe that that is a key part of us, getting to manage this. It's a key part of it. Vaccines are part of it, I think. Perhaps the virus and the virulence of the virus also drops off. So there's so many things that could happen, but I do believe testing, and frankly, you've been on CRT since March. I've kind of been preaching testing has to be there, but the challenge is getting there, that there is a test available. One of the challenges is we are intending and we are working on having a testing strategy. The challenge is we didn't really prefer the BD equipment because it wasn't quite as accurate as we had hoped, but lo and behold, that's what we got at Souderton and Dock Woods. So we need to use it because we are also then allocated test kits because of the equipment we have. We would have preferred Quidel. Having said that, you work with what you've got. But even so, there's not enough test kits to do the level of testing that needs to be done. So the concepts are good, the movement and the direction is appropriate, but the boots on the ground reality is not there yet. There's also another test that almost works like a pregnancy test, but that kind of more rapid testing ability, if you will, as opposed to one that has to go to a lab. And so the word that I've seen recently is sometime in September. I think it's a $750 million contract with Abbott that you kind of get the swab, put it in this credit card-like thing, wait 15 minutes and look at it. It appears that the rates of correctness, how you can rely on it, are fairly high. The challenge was that with symptomatic or asymptomatic individuals. So there's so many things to look at before you know whether the test is good or not. But that's another one that's coming. So there's other things in the pipeline as well, but we want to keep working at those things. But the challenge is the supply chain keeping up with the demand that's out there. But there's no question that a testing strategy is a key part of what we're looking at. But we would be there now if it weren't for the supply chain issues. So those are the things that we continue to work through.
And just so that I don't misunderstand, when you're saying a test that's similar to a pregnancy test, you don't mean you're taking anything into the bathroom.
No, I shouldn't. Yeah, I've just, that's been how people are referred to it. I probably maybe shouldn't even say it that way because no, absolutely not. It's just the idea that it's something you can do
quick and at home, and
it doesn't have to go to a lab. That's really, or doesn't need special equipment. Because even the rapid antigen test, even though it could be done at point of care, it needs a piece of equipment to read it. Whereas some of these new things, like the one I just referenced, it's this apparently around a $5 test that it's all self-contained and you do your thing. And so that's what I mean when I'm talking about a pregnancy-like test. It's a home test. So that's probably what I should change even the language and say, okay, it's more of a home test approach as opposed to something that needs a laboratory to be involved.
Gotcha. Mm-hmm. I guess if that was going to be the case, I might prefer having something jammed back up my nose if that was the other option. It's amazing to see how quickly, people are coming up with new tests and how they're able. We were talking about, science doesn't change and science doesn't change, but it is amazing to me to see what people are able to do when you really put resources towards trying to solve a problem.
Yeah, that's right. That's very true.
And even now we hear more conversation about vaccines. and what might or may not be happening with that, which is another a whole different topic, and certainly something that we'll have to be thinking about in CRT. But it's hard now because we just don't have any information.
Yeah, that's right. And certainly they're talking about phase 3 trials and that happening by the end of the year. And there's other things around, could they, move those things up? And so, that'll be a topic we're probably toward the end of our time today, but that is definitely something we'll be wanting to talk about too. And I'll want to reflect on, because there are just a lot of layers to all of these issues, whether it be testing, whether it be vaccines, et cetera. And even if you have a vaccine, will people trust it? How is their trust impacted by the rhetoric? There's just so many things that impact this. And how is it allocated? Who gets it first? So there's a lot of things to consider, and probably something we can spend almost a whole video some week on reflections on that area. So we won't get into those details today, but it is something that I think we'll need to be dealing with at some point.
Another common theme, I guess, I've heard from people this week is back to our issue of visitation, of course. People want more visitation and to be able to see their family, of course. So we're making progress, I think. I know that Willows was able to open up some more slots for visitation. Doc Woods is looking at some things. And also Lynn Ollenbach, our volunteer coordinator, has been reaching out to people to see if there are those who are interested perhaps in volunteering to assist with visitation, because of course the challenge is, per the state requirements, the visits must be monitored. And so we have to have staff or volunteers who are doing that. It's a little bit of an interesting situation, because here she is reaching out for volunteers, and we've spent 22 weeks telling people, be careful, stay away from others. It's a conundrum.
Yeah, that's right. And people need to do what they're comfortable with, and we certainly wouldn't want our request or openness to volunteers to be construed as that means everything we've been saying to date is incorrect. So people really need to do what they're comfortable with, and I recognize that many people may not be comfortable with that. On the other hand, it's an opportunity too, and we will, there would be appropriate PPE and those kind of things for those tasks. But yeah, it's always in that weird space that we need to be aware of. But it's not something we're certainly not requiring people to do. But it's putting an offer out there to say this is an opportunity. But I think you were talking about masks and friends and things like that. I think you had mentioned before the video that The Rock, Dwayne Johnson, right, that he got it from friends.
Yeah.
And so it just illustrates again how it can come from anywhere. And that's the risk with this change to visitation, and why we need to be vigilant.
Yeah.
We need to wear a mask, and eating with friends is probably the highest risk activity because you're on mask at that time. And so we want to do everything we can to help protect people, because as more and more people come on our campus, the commitment and vigilance around mask wearing and appropriate distancing just becomes that much more important. And there's illustrations every day of those situations where people thought they were safe and let down their guard a little bit. And that's what we need to keep thinking about.
That is so true. And I think it's interesting for me to see how we're trying to balance that need to keep everyone safe, but yet also say there are emotional, there are mental health, there are psychological ramifications of not being able to visit and see family. So how can we try to reach that happy medium with those?
Yeah, that's right. That's very true. Very true. And so it's not an easy fix. It's not a clear answer, but it's something we just need to be working at, be open to feedback, be making modifications, be learning from our successes and learning from our mistakes, and and just continuing to move forward
Yeah.
to work through it.
And we continue to develop strategies for how we can get more people in. So that'll keep happening.
Yeah, very true.
Final thoughts?
Oh, I don't think anything today other than, wear your mask in public and in private if you're with other people that aren't part of your typical household. But keep doing those things, stay vigilant, and just keep working at it, because it's so easy to let your guard down. And I would say, let's be gracious with each other, not be condemning of those people that may have forgotten, but assume the best. Assume, Malcolm Gladwell talked about this in one of his books I read, about positive sentiment override and negative sentiment override. And if I have a positive sentiment override about you, if you do something that I'm kind of wondering about, I will assume that you had positive intention. But if I have a negative sentiment override about you, I'm going to assume the worst. And I think it's easy. I'll just speak for myself, but I think in general human beings, but for myself to too often go to that, well, gee, what were they doing? As opposed to saying, well, let's take a positive potential for this reason. And so I think we just need to have grace with each other, but keep laying out the reminders as we work through it.
Well, thank you all for tuning in. Again, if you have questions, you can send them to coronavirusquestions@livingbranches.org, or call our hotline number or talk to anybody on campus. Thank you, and we'll see you next week.